Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. A new MDPI December study is sounding the alarm on what happens after hip fracture surgery for older adults, and the risks are sobering. Researchers analyzed data from 355 patients aged 60 and older, finding survival and independence often decline sharply in the years following surgery. The study tracked patients treated at a general hospital in Japan between 2020 and 2024. The average patient was 85 years old, and more than 80% were women. Before surgery, just over a third of the patients were already living in nursing homes, with the biggest changes after surgery. Within 1 year, nearly 1 in 4 patients died. By year 2, mortality climbed to 41%, and by year 3, 6 in 10 patients had passed away. Risk of institutionalization was significant. 42% of patients previously living elsewhere were newly admitted to nursing homes. The highest risk occurred within the first 9 months after surgery, a critical window for recovery and support. Researchers say outcomes aren't driven by surgery alone. Nutrition, functional recovery, social supports, income, and overall health play major roles in whether patients regain independence or decline. Their message is clear. Hip fracture surgery is not the finish line, it's the starting point. Targeted interventions, better discharge planning, and stronger post-acute supports could make the difference between recovery and long-term decline. Improving long-term outcomes means treating the whole person, not just the fracture. A major 2024 national report published in Medical Care found Medicaid reimburses nursing homes just 82 cents for every dollar of care provided, and released new findings showing how gaps ripple through staffing, services, and quality. The conclusion? When Medicaid doesn't cover the cost of care, facilities must make up the difference somewhere else or cut back. And for-profit nursing homes are far more Medicaid dependent. Nearly 1 in 5 for-profit facilities serve resident populations that are 80 to 100% Medicaid, compared to just 8% of nonprofits, leaving them with fewer higher-paying residents to offset losses. Even efficient facilities, researchers warn, may still be forced to reduce staffing, programming, or amenities, moves that can directly affect resident safety and quality of care. And this isn't just a for-profit issue. Nonprofits would also struggle if higher-paying residents disappear. For example, as traditional Medicare is replaced by lower-paying Medicare Advantage plans. Looking ahead, pressure could intensify. Nearly $1 trillion in proposed federal Medicaid cuts by 2034 could further destabilize the industry if states respond by lowering payments or tightening eligibility. At the Leading Age annual meeting, researchers tied Medicaid payments rates directly to higher CMS star ratings, especially inspection scores. Their message to policymakers? Payment matters, and when Medicaid payments fall short, quality of care often follows. Another new study suggests making nursing home inspections less predictable could significantly improve patient safety, potentially saving more lives. Researchers from UCLA, the University of Chicago, and Lehigh University analyzed staffing and patient outcomes around inspection dates. Right now, facilities can generally anticipate surveys about once a year, and predictability matters a lot. Data shows a clear pattern. Staffing and quality spike during inspections, stay elevated for several weeks, then gradually fall once inspection risk drops. Patients are more likely to die during low-risk periods when inspections feel unlikely and effort declines. When inspections are more erratic and harder to anticipate, nursing homes maintain higher staffing and performance levels more consistently. In fact, researchers found unpredictable inspections were nearly as effective as conducting more inspections overall. The current system already saves an estimated 850 lives a year, but the study found that making inspections more unpredictable without increasing frequency could save 12% more lives, equivalent to adding inspections without the added cost. States with tighter, less predictable inspection windows saw stronger effects, especially among for-profit facilities, which were more responsive to inspection risk. Inspection timing's a powerful, underused tool. By breaking the cycle of predictability, regulators could strengthen compliance, improve daily care, and save lives, without straining an already limited inspection budget. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.